So today there are 2 new cases of COVID-19 to report in managed isolation facilities. It's now been 75 days since the last case of COVID-19 was acquired locally from an unknown source. The first of today's cases is a man in his 60s who arrived in New Zealand on 10 July from Pakistan via Dubai. He is at the Sedima Hotel in Rotorua and tested positive at the day 3 routine testing during his time in managed isolation. The second case reported today is a woman in her 50s who arrived in New Zealand on 10 July from Dublin via Dubai. She's also staying at the Sedima Hotel in Rotorua and likewise tested positive on the day 3 testing during her stay there. So the total number of active cases in New Zealand presently is 27, and our total number of confirmed cases is now 1,197, and we will be updating the World Health Organization with that number. None of our current active cases is receiving hospital level care, and yesterday our laboratories completed 2,061 tests, and of those 902 were testing of people in managed isolation or quarantine at either the day 3 or around day 12 testing. Total number of tests completed to date is now 433,324. As the Minister said, yesterday we issued some updated guidance for clinicians around testing for COVID-19 in the community. The updated advice clarifies for health professionals which of the lower risk symptomatic people should be tested in the community. So this is testing of people with respiratory symptoms, all the people who are classified as being high index of suspicion, for example, because they work at the border or they live with someone who works at the border or live in a family where there's a member of international aircrew. All those people are already being tested. And this guidance clarifies the other groups of lower risk people in the community that should be offered swabbing. So that includes people who are at higher risk of complications should they get COVID-19, older people, people with pre-existing medical conditions, and also our Māori and Pacifica communities. And just to reiterate, note this is testing of people with respiratory symptoms. It's not asymptomatic testing. So, as has been emphasised over the last few days, it's very important New Zealanders are not complacent about the threat of COVID-19. We need to continue testing in the community as part of our efforts to detect any possible cases that may have slipped through the border. The updated advice also includes a reminder that just a throat swab is an acceptable test to be done in this group. People will be offered a nasopharyngeal swab. It can be quite unpleasant, and so it will be appropriate for a throat swab to also be used. The throat swab is slightly less sensitive because it needs you need to get more viral load on the throat swab to be able to return a positive test, but it's certainly a very acceptable test, and my hope is that with the offer of a throat swab, people will also accept that offer. So just to remind anyone with respiratory symptoms during this cough and cold season over winter, please do call Healthline or your GP to get advice about getting a test. And finally, just an update on the people whose tests results were delayed yesterday at the Novotel Ellerslie. Their day 12 testing results took slightly longer to come back than usual. All 12 negative tests had been returned by 6 o'clock last night, and 10 of the 12 people and others in their associated bubbles were then able to leave. 2 of the 12 stayed overnight and have left today. So it's important to note these tests were not mislaid or missing, but were in the system. They just took longer to get through the laboratory reporting process than expected. That was the case in 9 of them, and 3, the swabbing had been delayed for 3 people. It was undertaken, processed urgently, and the results back by 6 p.m. Thanks, Minister.
Thank you. I was very pleased to see the updated advice on testing going out, which will provide clarity for CBACs and for GPs on who to test. The updated advice also confirms that testing remains free and that testing in the community is an important part of our ongoing strategy to continue with the elimination of COVID-19. If people are offered a test, I strongly encourage them to take it. The updated advice also confirms that health professionals are funded to do COVID-19 swabs. Week before last actually, I visited a CBAC myself, and it was clear to me that the testing is a significant effort for our primary care workforce, and I do want to thank them for the very significant part that they are playing in ensuring that we've got a good level of testing as part of our response. This morning, the Prime Minister outlined the preparedness that we've put in place should there be a resurgence of COVID-19 in New Zealand, that is, should there be community transmission in New Zealand. We did this because we want the public and the business community to have as much certainty as possible around what would happen and how we would continue to use the alert level system in such a scenario. Our strategy continues to be elimination, and breaking the chain of transmission remains the foundation of our response no matter what. As the Prime Minister said, we do need to ensure that our border and our managed isolation facilities stay as tight as possible, and that our frontline workers at the border are using PPE and other protective measures, and that they are also being tested. I do know that New Zealanders will join me in showing our appreciation for each and every one of those people who are doing their bit to keep us safe, and we will do that by washing our hands, coughing or sneezing into our elbows, staying at home if we are unwell, and of course keeping our digital diaries. So on that, I wanted to pick up on a few points from this morning around contact tracing. There were a number of questions, so I wanted to run through what steps occur with contact tracing if there was a community outbreak. Contact tracing is a core public health response, and the basis of it is anchored in our public health units, contact tracing teams firstly undertaking interviews with cases to get a full understanding of their contacts. Based on the recommendations from the nzherald report, public health units have been working on capacity uplift to support a potential rise in COVID-19 cases, and the national contact tracing solution is now in use by 11 of our 12 public health units, and the 12th will be coming on board by the end of the month. Nationally, we know that public health units can investigate over 300 cases a day now, with extra surge capacity available should it be required. The Ministry is working to build additional capacity in this area by training its own staff to do case investigation as well. The National Close Contact Service can currently make up to 10,000 outbound calls a day for contact tracing, and by the end of August, I've been advised that will be doubled to 20,000 using surge capacity. A test of the contact tracing extended system is being planned with one public health unit by the beginning of August, and planning for similar testing with other public health units is also preparing to get underway. Finally, a few words on the Contact Tracer app. There were a number of questions about that this morning. I want to reiterate that the app is one part of a whole system of contact tracing that's being used, and it relies on every one of us doing our bit to ensure that it is effective. Even by downloading and registering with the app, you provide the Ministry of Health with your most up-to-date contact details, which is extremely useful if they need to get in touch with you as a result of contact tracing for another case. So thank you to the 596,000 New Zealanders who have taken that step so far to date. If you're watching this and you are not part of that group, I encourage you to do it today. Also, remember that any information you give to the Ministry of Health is only held by them and only used for the purposes of contact tracing. So we keep saying it, we'll keep saying it over and over. We can't be complacent, and we do need to be prepared if new cases of COVID-19 were to emerge in our community. If that was to happen tomorrow, based on the number of poster scans we're seeing, not enough New Zealanders would be able to remember their movements for us to efficiently trace who has been exposed to the virus and isolate them to stamp out its spread. We can all play a role in doing something about that. So my message to all New Zealanders, please step up your efforts, scan wherever you go, and keep a record of your movements. If you're a business or a place where people go and you've not yet downloaded COVID-19 QR code, please do so. Please make sure it is put in an accessible place where everybody can access it, including those with disabilities and in wheelchairs. If the virus was to re-emerge within our communities, we cannot afford there to be any delay, and we need people to be able to recall where they have been so that contact tracing can happen as quickly as possible.